Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. 2 years jail to Karnataka doctor for lending signatures to Mumbai Pathlab. A Karnataka-based pathologist has been sentenced to 2-year imprisonment for lending his signature to a Mumbai-based pathology lab that thereafter gave reports signed with the signature to the patients, holding 2 accused guilty for issuing lab reports without verification by an MD pathologist. The Court of Civil Judge Navi Mumbai recently sentenced them to imprisonment of 2 years. The Karnataka-based doctor as well as the DMLT who was running the Mumbai Path Lab had issued the forged pathology report for blood and urine test to a doctor who is also a member of a state association of pathologists and microbiologists. Apart from the jail term, the bench has also asked them to surrender their bail bond. Further, one of the accused has been asked to pay a fine of Rs 1,55,000 while the other has been asked to pay 1,25,000. DCGI asked all blood banks to register on E-RaktKosh. The apex drug regulator, Drug Controller General of India, has recently issued an advisory to all the blood banks operating in the country for registration of their blood centers on E-RaktKosh. As per the competent authority of the Ministry of Health and Family Welfare, Government of India, all licensed blood centers are required to register on the E-RaktKosh web portal within the next 1 week from the date of issue of the notice of advisory. According to a study which says that doctor mood increases the chance of medical negligence. The changes of medical negligence and consequently being sued for the same does depend on the doctor's mood at the time of work, a recent study in British Medical Journal has shown. The study, which was done on Australian doctors, showed that doctors are more likely to be sued for medical negligence if they are unhappy and overworked or working in rural areas or if they have suffered a recent injury or illness. The said research comes from the University of Melbourne, published today in the British Medical Journal, and the Australian first study also found that doctors with an agreeable personality were less likely to be sued. The research team, led by Dr. Owen Bradfield and Professor Matthew Spittle, analysed the responses of over 12,000 Australian doctors to the Medicine in Australia Balancing Employment and Life survey between 2013 to 18. Doctors who completed the survey answered questions about their age, sex, specialty, personality, health, life satisfaction, working conditions, and whether they had previously been sued. Dr. Bradfield said that this allowed us to analyze and correlate work, health, and personality factors with the doctor's risk of being sued. Their surgery at Ganga Ram Hospital Delhi, which brings back voice of a teenage boy after 7 years. Ganga Ram Hospital Department of Thoracic Surgery and Department of ENT received a 13-year-old male from Rajasthan in last week of April. The patient has a tracheostomy tube inserted in his breathing windpipe for more than 10 years. Due to long period of tracheostomy and a portion of missing windpipe, there was no airway for him to breathe normally. The child had neither spoken nor eaten normally for last 7 years. On 23rd April 2022, the child was wheeled inside the operation theatre. The teams from Department of Thoracic Surgery, ENT Anesthesia worked together for 6.5 hours. The surgery was totally successful, but the challenges were still there. The post-surgery management was very important. Worldwide monkeypox cases tally rises to 780. The World Health Organization on Sunday said it has been reported of 780 laboratory confirmed cases of monkeypox from 27 countries that are not endemic to the monkeypox virus. This represents an increase of 523 laboratory confirmed cases plus 203% since 29th May, when a total of 257 cases were reported. However, there has been no deaths associated with the current monkeypox outbreak. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.